Hey everybody, this is Julian from Raw Physique again. Today I'm going to do a review on Ashwagandha root. Now I've been taking this for about 8 months. Now I'm going to go ahead and give you my review, side effects, benefits, and whatnot that I've experienced with taking Ashwagandha root extract. And I'm also going to read what WebMD says about this guy right here. So without beating around the Ashwagandha root bush too much, let's go ahead and jump on WebMD. So I'm going to start with the overview for what WebMD says about Ashwagandha root, if I'm pronouncing that correctly. Anyway, ashwagandha is an evergreen shrub that grows in Asia and Africa. It is commonly used for stress. Maybe everyone should take it. There is a little evidence for its uses as an adaptogen. Adaptogens are plants and mushrooms that help your body respond to stress, anxiety, fatigue, and overall well-being. Sounds pretty good. You can take adaptogens by adding them to food or beverages, or take them as tinctures. Tinctures are concentrated herbal extracts made by soaking the bark, berries, leaves, dried or fresh, or roots from one or more plants into alcohol or vinegar. It sounds like that could be fun. Okay, back to WebMD before I get too sidetracked. Ashwagandha contains chemicals that might help calm the brain, reduce swelling, lower blood pressure, and alter the immune system. Since ashwagandha is traditionally used as an adaptogen, it is used for many conditions related to stress. Adaptogens are believed to help the body resist physical and mental stress. Cool. Some of the conditions it is used for include insomnia, aging, anxiety, and many others. Maybe everyone should take this. But there is no good evidence to support most of these uses. There is also no good evidence to support using ashwagandha for COVID-19. Why do people ask about all these things for COVID-19? Don't confuse ashwagandha with Physalis akinkenji. Alright, I promise this won't take too long. Mostly grown for its luminous papery lanterns. Okay, back to WebMD. For some reason people confuse it with that. Both are known as winter cherry. Also, don't confuse ashwagandha with American ginseng, Panax ginseng, or Eleutherio. I'm butchering this whole thing here. Don't worry, I'm not going to look that up. It's probably some type of a plant. Don't say I didn't tell you anything. Okay, we're on to uses. Possibly effective for insomnia. Taking ashwagandha by mouth seems to improve overall sleep and sleep quality in some people. Stress. Taking ashwagandha by mouth seems to help reduce stress in some people. It might also help reduce stress-related weight gain. Hey, that's good to know. There's interest in using ashwagandha for a number of other purposes, but there isn't enough reliable information to say whether it might be helpful. Okay, we are on to side effects. When taken by mouth, ashwagandha is possibly safe when used for up to 3 months. The long-term safety of ashwagandha is not known. Large doses of ashwagandha might cause stomach upset, diarrhea, and vomiting. Rarely, liver problems might occur. Rarely. When applied to the skin, there isn't enough reliable information to know if ashwagandha is safe or what the side effects may be. So don't be rubbing yourself down or anyone else with ashwagandha root. Alright, this is a quick one. We are up to precautions now. When taken by mouth, ashwagandha is possibly safe for up to 3 months. It said that. The long-term safety of ashwagandha is not known. The stuff I just read, this is new. When applied to the skin, nope, I read that. Pregnancy. It is likely unsafe to use ashwagandha when pregnant. There is some evidence that ashwagandha may cause miscarriages. Noted. Breastfeeding. There isn't enough reliable information to know if ashwagandha is safe to use when breastfeeding. Stay on the safe side and avoid use. Autoimmune diseases such as multiple sclerosis, MS, lupus, systemic lupus, erythematosus, SLE, butchered that, rheumatoid arthritis, RA, or other conditions. Ashwagandha might cause the immune system to become more active, and this could increase the symptoms of autoimmune diseases. I did not know that. If you have one or more of these conditions, it's best to avoid using ashwagandha root. Surgery. Ashwagandha may slow down the central nervous system. Healthcare providers worry that anesthesia and other medications during and after surgery might increase this effect. Stop taking ashwagandha at least 2 weeks before a scheduled surgery. Thyroid disorders. Ashwagandha might increase thyroid hormone levels. Ashwagandha should be used cautiously or avoided if you have a thyroid condition or take thyroid hormone medication. Now this says interactions. Moderate interactions. Be cautious with this combination. Medications that decrease the immune system, immunosuppressants, interacts with ashwagandha. Ashwagandha can increase the activity of the immune system. Some medications, such as those used after a transplant, decrease the activity of the immune system. Taking ashwagandha along with these medications might decrease the effects of these medications. Sedative medications. Benzodiazepines, benzos, interacts with ashwagandha. Shout out to all the pill poppers. Ashwagandha might cause sleepiness and slowed breathing. Some medications called sedatives, we all don't know what that is, can also cause sleepiness and slowed breathing. Taking ashwagandha with sedative medications might cause breathing problems and or too much sleepiness. Sedative medications, CNS depressants, interacts with ashwagandha. Ashwagandha might cause sleepiness and slowed breathing. Some medications called sedatives can also cause sleepiness and slowed breathing. It is the exact same thing that they had for the benzos. Thyroid hormone interacts with ashwagandha. The body naturally produces thyroid hormones. Ashwagandha might increase how much thyroid hormone the body produces. Taking ashwagandha with thyroid hormone pills might cause too much thyroid hormone in the body and increase the effects and side effects of thyroid hormone. Medications for diabetes. Anti-diabetic drugs. Interacts with ashwagandha. Ashwagandha might lower blood sugar levels. Taking ashwagandha along with diabetes medication might cause blood sugar to drop too low. Monitor your blood sugar closely. Monitor. Medications for high blood pressure. Anti-hypertensive drugs. Interacts with ashwagandha. Ashwagandha might lower blood pressure. Taking ashwagandha along with medications that lower blood pressure might cause blood pressure to go too low. Monitor your blood pressure closely. We are on to dosing. Ashwagandha has most often been used by adults in doses up to 1,000 milligrams per day for up to 12 weeks. Speak with a healthcare provider to find out what dose might be best for your specific condition, and that is dosing. Reviews. Effectiveness, 3.5 stars. Ease of use, 4.5 stars. All you gotta do is swallow a pill. Satisfaction, 3.5 stars. So it has a 3.7 overall rating, whatever that means. I guess it's okay for some people. Alright, so that is what WebMD says about ashwagandha. So this is the brand I'm taking. I'll post it over here. I've also taken this brand, so I'll post both of them up so you can see them, see how much they are. They're not too expensive. Usually it's like a 2 or 3 month supply you get with these. So I'm gonna read just another real quick thing. It's just, I'll make it as short and sweet as possible. It is just science-backed evidence for ashwagandha off of Forbes Health. So kind of reliable information here. So ashwagandha relieves stress and anxiety, lowers blood sugar and fat, increases muscle and strength, boosts fertility and testosterone levels in men. Yep, let's keep that up. Sharpens focus and memory, supports heart health, improves sexual function in women. At least one clinical study indicates that ashwagandha can benefit women experiencing sexual dysfunction. The administration of ashwagandha results in significant improvements in arousal, lubrication, orgasm, and satisfaction, as self-reported by the participants. It also significantly improved the number of successful sexual encounters and improved metrics of distress around their sex lives and sexuality. So also, people taking it tend to have lower body fat percentages and higher counts of muscle on their body too. So, you know, a lot of that is minimal, but you gotta take what you can get. So, my experience with ashwagandha. So it's nothing completely crazy or anything like that. No bad side effects. I would cycle on it for 2 months, cycle off of it for a month, cycle back on it for 2 months. Just because there's not too much long-term use studies on ashwagandha root, and I don't want to give myself anything horrible or permanently lower my testosterone or any other level like that. So cycling on and off with a month in between. I do take lower than the 1,000 milligrams. This is 600 milligram tablets in this My Kind Organics. Also, you want to make sure you're not getting a crap Walmart or crap China brand of ashwagandha root, because otherwise you'll just be taking lead capsules. So cycling through this, when I'm on it, I think I actually do feel a little less stressed, and maybe I get a little better night's sleep. As for strength levels or stamina, anything like that, I really don't notice anything. I have been making gains on it, but I slowly make gains regardless. So I can't point at the ashwagandha and say that is what it's actually doing. But I can say that it is helping me sleep a little bit better. And it does seem like I'm not quite as angry all the time. My stress level might be a little lower than my normal baseline, I guess. And with the side effects, I don't notice anything at all. I do not notice anything whatsoever. So at least for me, it seems like the effects are minimal, but if it does decrease stress level, then ultimately that's good, and that can help you make gains while you're lifting, because having more cortisol throughout your system will impair any type of muscle gain you're trying to make, and longevity and health, all that good stuff. So if this does lower stress, that will definitely help out in that area right there, which is pretty significant actually. If you're not as stressed, less cortisol, and it's helping you sleep, that's like a win-win-win right there. And it does, what these studies mention, it helps lower body fat. So that's also helpful. That's also good for inflammation and cortisol. If you have higher cortisol levels, you're more likely to put on stress weight and stress fat. So it all around seems pretty good if you could just get the actual ashwagandha root and not some like horrible ripoff. So definitely get something with good reviews, because it means most likely, it could be a placebo with some people, but most likely if it has a bunch of good reviews on it, like a couple thousand, then people are experiencing something, and hopefully it's actual ashwagandha and not some other random stimulant they put in there to make people feel better. But anyway, getting off subject again, am I going to keep taking it? Yes, definitely, because there is evidence. There is, definitely a little bit of evidence with muscle gain, strength, less stress, better sleep, improved cognition and memory, supposedly, in other studies, and even their attention spans. So it seems like a good product. The issue is that there's no long-term studies for it, and that's what that's what needs to happen, and that's what eventually is going to happen. But that being said, long-term study, God knows how long we would have to wait to get any significant information on how this affects you in the long term if you keep taking it. And studies have also shown that it can increase VO2 max. There's a couple studies that say that, which basically means you have like a healthy heart. So yeah, I'm going to keep taking it. Consult your doctor if you want to before you start taking this. And if you're like me at all, then you usually start out on a lower dose and ramp up to the normal dosing, just in case there is any bad side effects. You don't want to be 1,000 milligrams in and have some type of shitty allergic reaction to ashwagandha. It'd be better to be 500 milligrams in and have a shitty reaction. But yeah, it's a good supplement for multiple things, and I'm definitely going to keep taking it. Alright y'all, if you have any questions or comments, leave them down below. Please subscribe over here. Check out these videos over here. And until my next review on something, everyone be safe out there. Peace!